Okay, welcome to our live stream at Deuk Spine. This patient has a herniated degenerated disc at L3-4, L4-5 on the left side. He has back pain coming from those damaged discs, and we're going to go in and fix those discs and take away his back pain. He is from Arkansas. We're going to get started. All right, first thing we're going to do is give some numbing medicine so that we can place our needles. And we're going to numb the whole area up nicely. And then we're going to place what's called a spinal needle, which is a long needle, 18 gauge. Shot. All right, so we need to be a little higher. Shot. All right, Jordan, is that S1 down there? Shot. Perfect. All right. If you have any questions, feel free to ask us. Shot. We have more blood from the needle puncture than anything else. Shot. Thanks, Louis. Shot. Shot. Everyone agree that's 4-5 shot? Now, folks, if you've been with us for the last surgery, you'll know the last patient that we just did. Remember how deep his back was? This patient is quite the opposite. He is very shallow. His spine is closer to the back. Doing all right? Yep. All right. Let's go ahead and get an AP. Shot. All right. Looking good. He's got some arthritis in his facet joints. Okie dokie. Lay still, you're doing great, Shot. You can see we're at the 4-5 disc. Everyone agree? Shot. You doing all right? Shot. Okay, now we actually sunk the needle to the hilt again, but this time his spine is more, he's got a more wide body, so that's why, rather than a deep spine. All right, so that's 4-5, everyone agree? Next is going to be 3-4, we're all in agreement. I'm going to go ahead and cut this way today. Our incision is 7 millimeters. It's just wide enough to get the tube in. The tube I'm talking about is the one we do the surgery through. Shot. Looking good. All right, let's see if there's any questions.
No questions.
Okay, don't move. Shot. He's giving me a little wiggly worm. Shot. Shot, AP. All right, very good. So far things are going well.
We have a comment from Edward on YouTube.
Sure.
3-level procedure done 2 years and 1 month ago. Best decision ever made. Thank you, Dr. Deuk and staff.
Edward, you're welcome. It's so nice for you to join our broadcast. So for those of you watching, Edward is one of our patients, and he said he had a surgery 2.5 years ago, I think, right?
2 years, 1 month.
2 years, 1 month, and he's doing fantastic. Lay still. All right, very good. And our last patient is already ready to go, by the way. I just saw him in the recovery room. He's eating goldfish. Are you giving him a little more? Burndes?
Yeah, I did.
Yeah, because he's hopping around.
Keep your head still. You're doing great, my friend, all right? Keep your head still.
Just lay still. Actually, we can probably get in there and get it done. Shot? I need him awake because I want to do his discogram. All right, shot. I think we're about ready. Lay still.
Stay, keep your head down, all right? Keep your
Shot.
head down. Don't move too much, all right?
Give me an AP. Lay still.
Keep your head down. You're doing fine.
You're okay.
I need you to keep your head still, all right?
Mm-hmm.
Keep your head nice and still.
Let's let him wake up, I guess.
Yes,
All right. Lay still. Don't move around.
hey, my friend. Hey,
Lay still.
stop moving, all right?
All right. So just to talk about his back pain, he has back pain in this area. And when I looked at his MRI, I saw that he had 2 discs that were problematic. L3-4, L4-5. Lay still.
Keep your head down, all right? Don't move. You're in surgery. You're doing great.
Yeah, you're doing great. Just lay still.
Stop moving, buddy.
David, lay back down.
Mm.
David, I need you to lay back down, buddy.
Let's just,
David, you're in
hey,
surgery, my man. I need you to lay back
hello,
Hey,
David, hey, lay back down.
Jordan.
hey, my friend. You're doing great. Stop moving, okay? Can you open your eyes? We're going to ask you some questions now.
No,
all right?
no first names.
I apologize.
Lay still.
Hey, bud. Hey.
You're doing great. All right, well, unfortunately, he's not really cooperative, so it's going to be hard for us to do his discogram. You got to lay still. You're on the operating table. Stop moving.
Very tight. Make sure that it's tight.
Lay still. You want to get your surgery done, you're going to have to lay still. Stop moving around.
Hey, buddy. Some deep breaths, okay? Try to relax.
There you go. Slow down. Okay.
Stop moving.
You're okay.
Lay still. Lay still.
You're okay.
We need you to lay still. We need you awake for right now to help out.
You all right?
Don't move.
He was asking for ketamine.
For what?
Ketamine. He's a pharmacist.
Oh, hell no.
It's okay, okay? Try to
Lay still.
All right, Dr. Berndes is giving you something.
All right, so while we're waiting for him to wake up, let's go ahead and show our video on what causes the back pain. And that will be perfect because we'll be ready to do his discogram, hopefully. All right, our patient has calmed down and we're almost got him wide awake. You okay? So we're going to move forward in a moment with the surgery. Can I test his discs?
Okay, because you pulled out all the straps. Okay, my friend, so we're going to put your arm back here.
Watch the scope. Watch the scope. Don't move.
Don't move your arm. I need your arm loose. I need your arm loose. You're doing fine.
Squeeze my hand.
Back here. Good.
Lay still. Stop moving. All right. So we're going to test the disc in a moment, but let's go ahead and show one more video while we're waiting, because he's still very fidgety. The other one, how the Deuk laser disc repair works. All right, our patient is not cooperative in the least bit. And because of that, we're not able to wake him up to do the discogram. He's just wiggling around too much. So we're going to go ahead and just put him back to sleep. And we're going to do the chromodiscogram and move on with the Deuk laser disc repair. If he doesn't stop moving, we're going to have to abort his surgery.
We have a question from Ali Cameron on Facebook.
Sure.
Would you recommend people have a muscle relaxant to stop any spasms like this?
This is not spasms. This is movement voluntary. You can't stop it with a muscle relaxer.
Can you hear me? Can you try to lay still? Dr. Deuk needs to do the surgery, okay? If you keep moving around, you won't be able
Shot.
to do it. You gotta
All right,
stay
good.
still.
Shot. Numb them. Jordan, paying attention? That's you, buddy. I need a shot. So I'm giving him some more medicine that will help ease the discomfort he's having. Shot? All right. We're on our way to fix the first disc, which is the L3-4. You can see a giant tear. I'm going to go through the tear and the herniation, essentially drive them back into the disc. Shot. Take that out. So you see how easy that went in. There's just a giant tear there. Good. Good job, Jordan. That's the way to move in 2 planes. I got it.
Seating, scope in the seating, please. Thank you.
Is he requiring a lot of propofol? Huh? No? All right. Hold it. Well, unfortunately, every patient presents challenges, one form or another. Yeah. You can see the herniation here. We are inside the disc. There's a piece of herniation there. How's he doing? All right, there's the end of the tear. This is, remember, left side L3-4. We're doing 3-4 and 4-5. I suspect the 4-5 disc will be more degenerated. It's a little overexposed, guys.
Right hands down, please. Ali, please. Thank you. You got it? Thank you.
Is that the right one? I would say one more notch down. Is that the right one you guys are?
Yes.
It still seems quite overexposed.
More.
I think that's good right there.
Thank you. Thank you.
Now this is the annular debridement that's part of our surgery. They already saw the DLDR technique, right?
Yes, Dr. Duke.
Mm-hmm. Very good. All right, feel free to ask questions if you have any.
Copy that.
A lot of scar tissue, some calcification. You guys see it right there in the ligament, the gold stuff. There's the end of the tear right there, coming to the outer annulus. Now we have this case, and we have one more after this. Our last case is a patient from Arizona. He has one herniated disc, L5-S1. He'll be the shortest case of the day. We don't put the shortest cases at the end of the day for that reason. We put them at the end of the day depending on their health. The sickest people go first. The biggest cases go first. At the end of the day, the cases that are the least invasive and require the least amount of recovery, those patients always go at the end of the day. Grabber.
We have a question from Ali Cameroon on Facebook.
Sure.
Is it possible to share the ages of people?
Share the pages of
Ages.
people.
Ages.
I don't understand the question. Oh, age.
Yes.
I don't think so. We don't want to give away any personal data. So I would say no. But I can give you a ballpark if you want to know. Which patient are you interested in knowing about? If you want to know about this patient is somewhere close to 70, right? Yeah, close to 70. Just about done. There's the last of the tear. I feel really good about his surgery. A little bit of blood. That's some epidural vein bleeding. It's not a big deal. It's very minimal. Not concerned about the blood loss. His blood loss for this case will be about 1 milliliter. Maybe in his case 2 milliliters, because he's on some type of a thinner. I'm not sure what it is, but it is definitely, he's definitely got thinner blood than normal. A lot of people take herbals like ginkgo biloba, fish oil. Fish oil is not an herbal, but turmeric, and they end up having some inhibited platelet function, so they actually have a little more bleeding than we would normally expect. He's one of them. I'm not sure what his herb could be that he's on, right? But I think he's on something that could be affecting his platelet function. All right, that's about it. I don't see really anything else. Nice and clean. All right. Pretty much done with that one. Got one more to go. Yeah. Oh, fine. It's fine. This patient was around 70. The last patient was in his 50s. Yeah. the one we did before. The second patient of the day, oh, he's moving. That guy was in his close to 80, right? Yeah, 80s. He was from West Virginia?
Yes, sir.
Yeah. Our West Virginia patient was in his 80s. Come on in.
Good.
We didn't have any Florida patients today.
No?
We started with,
Oh, where was she from?
she was Indianapolis, Indiana.
Indiana, yes. And
So
West
first
Virginia,
patient was Indiana, then West Virginia,
and then Jersey, Colorado,
then Jersey, Colorado,
and now Arkansas.
Arkansas, and our last
Then
patient's Arizona. So no Florida patients. See, Disneyland is not the only one that gets tourists in Florida. That's it. Deuk Spine gets tourists, and lots of them. All right, shot. We're going to do this next disc, and let's just hope and pray that our patient stays calm and comfortable, because we really need him to be for the next 15 minutes. Num num. Lots of num num. Shot. For those of you who wonder, what is num num? Num num is Marcaine, lidocaine. Shot. It really is a local analgesic given by doctors in the areas where nerves are in an attempt to make the patient have less pain, but also give the anesthesiologist a break on how much sedative he has to give. Shot. All right. Shot. Take it. Shot. We're in like Flynn. That's a big tear. Huge tear. I mean, that went in so easy. He's got two gigantic tears. No wonder why he's in so much pain. Let's see it. I know it like I know my children. You know? Nice pressure on the irrigation. I need to see it up there, guys. All right, I need to see it.
Thank you.
10 minutes, Berndes. Maybe 15 at most. All right, so far this patient's doing well. As long as he's asleep, he's doing fine. As soon as he starts having any pain, he gets extremely fidgety. So let's talk for a moment about pain tolerance. You've all heard it, pain tolerance. People have different pain tolerances. It's absolutely true. Some people have a very low pain threshold, pain tolerance. Just the smallest amount of painful stimulation really gets them going. That would be this patient. And then you've got patients like the last one who you could stick a knife in their body and they don't really move. So isn't it interesting though how these patients with different pain tolerances all come here for same surgery? Clearly, it's not the acute pain that's the problem, it's the chronic pain. And the pain tolerance for chronic pain is different than acute pain. Chronic pain and acute pain, they travel by different pathways up to the brain. What brings everybody here is it's pain, ultimately. How they perceive it, how it affects their life, their quality of life, their day-to-day activities, their work, their relationships, their activity levels. Our goal is to get rid of the pain so these patients can have a normal life. There's a big piece of herniation. And it's stuck right here. You see that? The herniation is literally stuck to the annulus fibrosus.
Yes, we do.
It's not letting it go. I have to release it. This is the debridement that I talk about. Okay? Without the laser, this is not possible. If you're not using a laser in spine surgery on the disc, you're leaving herniation behind. That's my opinion. Now, we're always going to leave some herniation behind. It's not possible to remove all of the herniation. But the key is to debride the tear. You want to get the herniation out of the tear. If you do that, then the tear will heal in a pain-free state. That's what we're hoping for here, for all of our patients. That's what the Deuk laser disc repair's purpose is, to allow the disc to heal in a pain-free state.
We have a question from Bullseye Savannah Cat on YouTube. Is there a difference between disc pain and facet pain?
Yes, there is a difference between disc pain and facet pain. Disc pain is pain from the disc, specifically a posterior annular tear, like the one we're fixing right now. Facet pain is pain from the facet joint. The facet joint and the disc are two different joints. The disc is in the middle, the facet is in the back. Guys, just 5 minutes. And facet pain, there's a left and a right facet for every disc. So the facet pain is either going to be left, right, or bilateral. It's my job to figure out where it's coming from, which facets. And it's not an easy task, folks. It requires an intimate knowledge of the anatomy of the spine. And not many doctors have that. But I've done thousands of surgeries, open surgeries, before I did endoscopic. So I have a very intimate knowledge of spinal anatomy. And as such, I'm able to tell where pain comes from on the physical exam. Not many doctors can do that. So I know exactly where the facets are located and which ones they are. 5 minutes max. Just finishing up this tear. Could be less than 5 minutes. You can see the bone there, the pink stuff. That's the end plate. You guys see the end plate on the left at 9 o'clock?
Yes, we do.
The end plate is the bone. All right, there's the end of the tear. You can see the epidural space. See some fat. Wants to poke its head out and visit and say hi. I'm going to have to zap it back a little bit. We're not here for the fat, but sometimes the fat pokes its head into business it shouldn't be, aka the herniation. And I have to zap it a little bit. That way I can see what I'm doing. Otherwise it gets hard with all the fat billowing out. You can't see.
We have a question from Bullseye Savannah Cat. What does the diagnostic of the source of the facet pain look like?
The diagnosis is me. It's a clinical diagnosis. But you can confirm it with a facet joint injection, a block. So it's a clinical diagnosis made on the physical exam, presentation of the patient, but it can be confirmed, if you're not sure, with a block. Look at that herniation right there. That was a good one. All right, 1 more minute left, I think. What? I'm having trouble here, Louis. Hold it. I don't see any more herniation. Laser.
Oh, no, no.
No, I don't see any more herniation, but there's still the tear. 30 seconds. Now go ahead and type up your questions. I'll come answer them for you. I've already done the timeout on our next patient, so they should be ready to go. I would call the scope use a 6 so far. That's it right there. He does not like that. A lot of that's just scar tissue right there. We're not here to take all the scar tissue away. It's not possible. We'll take what we need to, what we can. That's scar tissue, by the way, from all the inflammation, from the herniation over the years. It adds up and get pretty thick. Grabber. We're looking lateral. Looking good. Grabber. All right, that should be it.
We have a question from Karen on Facebook. If you have disc degeneration, will this type of surgery help?
Yes.
And does it have to be repeated down the track?
This surgery does work for disc degeneration. It's the best surgery you can do for disc degeneration. There is no fix structurally for disc degeneration. But this surgery takes away the pain. The only thing you have to do with disc degeneration is get rid of the pain. And this is the only surgery that gets rid of the pain. It targets the source of the pain, which is the annular tear. The only other surgery that works is a fusion. But why have a fusion when you don't need it? Fusion is overkill. It's too aggressive. Look at the piece of herniation here. You guys see this?
Yes, we do.
This is just some of the herniation that's come out. A lot of it ends up in the bag or on the towel. Take a look here, guys. The whole surgery was done with this small incision. This patient's going to go home in 35 minutes. You can't do that with a fusion. Fusion, they're going to be usually in the hospital for days on painkillers for days. Let me have a stapler. You clean it. All right. All right, let's go ahead and show the viewers some of our past patients who have had this procedure. Good morning, I'm Dr. Deuk at the Deuk Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Deuk laser disc repair. We performed that 12 hours ago. And here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day. And I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm quarter-inch incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Deuk laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do, because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are pain-free for the first time in many years.
Many years, many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going?
All right. Are we live?
Yes.
All right. I got my co-pilot Sanjay here, and we're flying through the day. We've completed 4 surgeries so far. We have 1 more to go.
Successfully.
Successfully, yes. All 4 successful. We've achieved all the goals surgically we set out. Treating discs, treating facets. So this case presented some unique challenges once again, and we just haven't gotten a break today. This case, the patient, as soon as we started waking him up to do the discogram, he started squirming around and he would not cooperate. So we decided at that point, let's just put him back down to sleep and let's get this surgery done. So we didn't get to do a discogram. I really wanted to, but he just wouldn't stop fidgeting around on the table, and it became a situation where, you know, the patient could actually get hurt. They can fall off the table, they can pull their muscle, whatever, moving around. So we just felt it was best to move on and get the surgery done. We did it. Got everything done. I think he's going to do just fine. We were able to get in at L3-4, L4-5 and clean out those discs. So I don't think we have any questions.
I have a question.
Sure.
So how would you rate this surgery as compared to the previous surgery in terms of the thickness? As you mentioned during the surgery, the spine was closer to the skin as compared to deep inside.
Yeah, Sanjay's right. So the last surgery we did, the patient was very, very thick and his spine was way down here. So to get to it, I had to go deep, you know, like Marietta Trench deep. But this last one I just did, the spine was closer to the skin, so I was more of an oblique angle, you know. We were able to get in and fix those discs pretty well. I would rate this one from a surgical standpoint difficulty. So getting to the discs wasn't too bad. In this case, access, we call it the access, accessing the annular tear and the herniation wasn't bad at all. It was pretty good. I give it a 3, 4. But the disc itself was hard to remove just because of sort of the consistency of the herniation. It was very scarred, very stringy, very sticky. It didn't want to come out. Those pieces of herniation didn't want to come out. I had to use a lot of laser energy to get the annulus debrided completely to my satisfaction. And so, you know, if I were to give it a rating, I would say that that part was probably around a 6.5, 7, you know, the disc part, my work on the disc. It wasn't easy.
I think that's all.
All right. This patient that we just completed, he was from Arkansas, and the next patient is from a state with an A, it's Arizona, all the way on the other side of the United States. He's traveled here. He's having the L5-S1 plus the facets done at L4-5, L5-S1. All right. Thanks for